let's get to the latest COVID numbers. In India reported 2,64,202 COVID cases in the last 24 hours. That's up by 6.7% from yesterday. And currently India's daily positivity rate is at a whopping 14.7%. Well, to talk more about this situation, we're joined by Dr. Shailesh Jain, ICMR scholar and chairman, Universal Hospital, Delhi, Dr. Rajiv Jayadevan, Vice Chairman, Research Cell, Kerala, State IMA, member, National IMA Task Force, and Dr. Ishra Gilada, consultant in HIV infectious diseases and Secretary General, Organized Medicine, Academic Guild. Thank you so much, doctors, for joining us. And first to you, Dr. Jain, very worrying situation with India reporting over 2.6 lakh cases today. In fact, some estimates even predict, given, the way the cases are rising and the positivity rate, it could even go up like the US has gone up to, 7 lakhs a day.
There is no point in taking any action of now, because I personally feel that we have already missed the bus by not restricting the flight to the high-risk countries, by not enforcing the implementation of the COVID-appropriate behavior in the public places. We have to understand, Gargi, because in Delhi also we are getting around 30,000 cases per day with a positivity rate of around 30%. Everything is going on. 100% capacity in metro, 100% capacity in CNG bus, election is going on. Then how you are going to control the positivity rate and the number in our country? I personally feel government has also stressed this time that since the infection is mild in nature, as soon as the peak comes of this COVID, it will be better for the country. Because by holding the election, by making the 100% capacity in the public buses into the metros, you are not going to control the COVID wave. First thing. Second thing you have to understand, it's still yesterday we have 31 mortalities in our country, around 200 mortalities in our country. One mortality in a family is 100% loss of that family. In my hospital also, we have a patient in the ICU who is 30-year-old without any comorbidity. She's on 20 and 30 liters of oxygen. Another patient who has undergone for the lung transplant surgery is getting care after COVID second wave. So we have to take the strict protocol on the individual level. I personally feel that government might not be able to take the action. We as an individual has to follow what we are saying since last 2 years, COVID appropriate behavior. That is the only way to pull out the COVID infection yourself.
All right, interesting. So you're saying that, the government doesn't seem to be taking any very stringent measures. Yes, you're right. Festivals are being celebrated across the country. It's harvest festival time. Gatherings are being allowed. On Makar Sankranti, we're seeing thousands taking a dip in Prayagraj. Dr. Jayadevan, your view on this, that, we're going to see this massive rise. It's going to peak and then, it'll start to come down. And basically what we have to do is protect our own families, protect ourselves, and be very sensitive to people within our families, people who may be more who may have more comorbidities. Though worrying with Dr. Jain saying that a person in his 30s is also facing a critical situation.
Yes, unfortunately there is a narrative, as Dr. Jain said, there is a narrative that this is a mild condition. Absolutely wrong. The reason it is not mild is threefold. A, we have a large number of people, I repeat, number of people in our country who are A, older, and B, middle-aged, who have severe comorbid conditions known and unknown. COVID-19 is not a cold. It affects the entire body one way or the other because it spreads widespread to so many different organs. People with comorbid conditions can quickly turn ill, and younger people that predominantly are affected by Omicron, many of them are having debilitating symptoms that are keeping them in bed for a long time. That translates to substantial loss of our workforce, especially in our hospitals where nurses and doctors and other staff are staying away because they are ill. Now, when you couple that with an increased workload of patients coming in, you see there is a twofold problem there. And the narrative that this is only a mild illness will promote irresponsible behavior by people. This is where we lost a little bit of truth in our communication around the world. there's an overwhelming narrative that this can be controlled by a vaccine or by an antiviral agent or monoclonal antibodies. That is wrong. COVID-19 is a behavioral disease. The spread of the virus is directly linked with how people gather, especially indoors. If we don't keep a lid on indoor gatherings, the virus will spin out of control. Now, indoor gatherings are subject to individual decisions. Individual decision is different from collective decision. For an individual, they will always seek the most favorable opinion. If somebody says on television, it is mild, they'll say, it is mild, let me go and have a party. But that is where government narratives have to come in, restrictions have to come in, advisories have to come in and tell individuals in no uncertain terms, until the threat passes, they have to stay close and keep the social bubble small and stay away from social gatherings. If we rely on individual responsibility, this will not work in terms of a public health strategy.
All right, that's interesting. So you're saying, that the messaging from the government needs to be stronger, and we have been seeing some flip-flops, with one top epidemiologist of the government saying this is just, it's like a cold, it's going to go, there's nothing we can do to stop it, then at the same time saying not to test, then saying some in the families should test, some should isolate, 7 days isolation. Dr. Gilada, your view on, what we're seeing currently in India, and interesting seeing, also watching what's happening abroad in the UK, they've reduced the isolation time to just 5 days.
Gargi, thank you very much for having me on the show. Firstly, in this pandemic, what we have seen in the third wave, the definition of mild is totally changed. Somebody has a severe headache, it is called mild. Somebody has a severe sore throat, it is called mild. Somebody has got a severe backache, excruciating pain, body ache, it is called mild. Number two, everybody is having a symptom. So everybody, one of the people is saying 80% are asymptomatic. I have not seen a single case which is asymptomatic. Symptom may be less or more, but everybody is symptomatic. Third, everybody is infected. If in a family one is infected, understood, otherwise everybody is infected. So this kind of things are there in the this current situation. Now, US has done some kind of study to show that the virus goes up faster, comes down faster. Therefore, the quarantine can be reduced from 10 days to 5 days. It is both for convenience and both for science. And I think same thing should be done in India also, because we don't have place to quarantine people. And unnecessarily, if you keep people quarantined in some kind of place, they will pick up some other infections from there. So they will be out of COVID, but they will pick up other infections. Hospitals or quarantine places are also not safe for everybody to just go and sleep there for a week or so, 10 days. So I think we should look at those things. What has happened currently, that 25%, 30% of the medical community is infected. Now, this is a total criminal negligence on the part of the policymakers. Had they taken decision a month before, 2 months before, we could have saved. You look at the trajectory of current infection. Those who are infected, they are all those who have got vaccinated 10 months back, 9 months back, 8 months back. Those who have been recently vaccinated, nothing happened to them. So I think we are unnecessarily putting burden on the society. People who are sitting there in those places, they have not seen a single case. They just go by paper and numbers, and they are just please each other, and they are making all these kind of guidelines, putting people on to follow those guidelines, and therefore people are not following anymore. So I think we should be very much pragmatic, we should be very practical, and we should see to it that we can revert the pandemic's course in at least rural hinterland and semi-urban places. Currently what we are seeing in is the urban places, and actually there is a definition of insanity. You do different experiment and expect the same result. So I think they are doing here and there, but they are not able to get any kind of result. So I think we should look at those issues and take strict measures to see that rural hinterland is saved at this place.
Right. I think that's what we can do now, control the spread to other areas, and that's what the Prime Minister also, when he spoke to the Chief Ministers yesterday, spoke about, containing, places where we're seeing the cases spreading rapidly. Dr. Jain, also, we do have the booster shots happening now, but many of the doctors and experts have said it's, it's very late in the day, because the third wave is pretty much upon us. We're in the midst of it right now, and the booster doses perhaps will help later on. But for the moment, it's not going to really protect anyone, given the rate at which it's being, rolled out.
Gargi, it has been proven fact all over the world. The vaccine which will provide immunity from the corona is B cell mediated immunity, and it stays in your body for 6 months. taking the booster dose after 9 months, when the antibody level in your body is already very low, it will give the efficacy after 15 to 20 days. Like Dr. Ishwar said, that the infection we are seeing in the COVID is in the patient who is vaccinated 10 months or 12 months before. The person who is recently infected, you are not finding the infection in that case. One more thing, Gargi, like Dr. Ishwar said, the convenience for the isolation period, like 7-day isolation, 5-day isolation. Yesterday we have seen a circular in Delhi, one of the prestigious medical college of Delhi, that they have issued a circular for their paramedical and doctors that isolation is only for the 3 days. As a clinician, I am not able to understand from where they have got the data that after 7 days, if the patient is still positive, he will not spread the infection. Because in my immediate family, I am not finding anybody that who becomes negative after 7 days of the isolation. Everybody in fact, hospital also, the patient getting negative after 10 to 12 days only. I am not comfortable with the 3-day isolation or 5-day isolation. First thing, the booster dose should be given much earlier, but give that. As an individual, through your channel, I will request to each and every family that if in your family, if you have anybody elder more than 50 years, you must isolate them, because does not allow them to go anywhere, because this infection, this COVID time, third wave is very, very highly infective, but less lethal. Like Dr. Ishwar said, infection is in everybody, symptom in everybody. In my personal opinion, mild infection means asymptomatic. We are not finding any patient who is asymptomatic. Government is taking mild means no mortality. If patient is not expiring, it is a mild infection. That is 100% from the government perspective.
Right, Dr. Jayadevan, your view on this, and also if you could tell us what are we seeing in children, because that's the big worry now with this cases spreading the way it is. Many of the adults vaccinated, so perhaps the impact will be lesser, but in children, that is the worry as they remain, totally unprotected.
Well, in India, we have data about children being affected during the past waves. For the most part, they've not had severe outcomes. We've had a few cases of what is called MISC, which is a multi-inflammatory syndrome, which initially had a higher mortality, but since treatments have been streamlined, the mortality has been down. But that happens to children weeks after the initial infection, which may or may not be symptomatic. The second issue we've seen is severe outcomes in children typically occur in a very, very tiny number of individuals who are unfortunate to have other severe comorbid conditions like cerebral palsy and other conditions. Overall, the outcomes have been mild. We do not have enough data on Omicron specifically in children, but if you look at the PGI admission series, it closely parallels the admission series from South Africa, where the profile of inpatients have shifted at least 2 decades younger. So if you compare our own profile, the profile of patients who are in our hospitals, not necessarily critically ill, but in our hospitals are younger. So from that perspective, if younger people are affected, yes, we can expect a little bit more illness in the children. But children have excellent, what is called innate immunity. That's our immediate response is so good. They're able to get rid of this virus before it affects their organ systems. That is how children get away with it.
All right. Well, thank you so much, doctors, for joining us on the program today and, really speaking out about how we should be treating the spread of this latest variant and the third wave that we're seeing currently. Thank you so much.